As a group fitness instructor, Lissa Marth teaches 12 classes a week. 3 years ago, she thought she had pulled a muscle in her groin, but she didn't.
The pain started to go from dull to worse.
Lissa Marth tried everything: ice, over-the-counter pain meds, even doctor-prescribed medications, but
I never gave anything up. I just did it through excruciating pain until it got to the point where I literally could not take any impact at all on the joint any longer.
After 3 years of doctor visits, x-rays, a lot of research on the internet, plus searching for the right surgeon, she knew she needed a left hip replacement.
I had no cartilage left at all. I learned that there really weren't any other options.
After more research, she turned to Dr. Michael Schnabelt, an orthopedic surgeon at Aurora BayCare Medical Center.
Alyssa had fairly classic osteoarthritis where the cartilage was just gone and she was basically bone on bone.
Lissa had two options: a posterior hip replacement, where a large incision is made along the side through the back of the hip, which cuts through muscles and requires a longer hospital stay.
From the patient's standpoint, it's a lot more painful, longer recovery.
Or an anterior hip replacement, where the incision is in the front and is a minimally invasive surgery.
We make a much smaller incision. It's typically the width of my hand here, right up the front, and we just divide and go between the muscles, so we're not actually cutting the muscle.
Which offers a lot of benefits.
And that allows the hip to heal much quicker. There's a lot less pain. We can do these surgeries as an outpatient where you go home the same day in the appropriate patient, and the patients get back to work and other activities much faster.
Lissa already knew she wanted the anterior hip replacement, and why she chose Dr. Schnabelt, who's done more than 1,000 of them in 6 years.
So best chance for no infection, no muscles cut, quick short-term recovery time.
Lissa was back to teaching class in 7 weeks.
And here I am today feeling like $1 million.
Dr. Schnabelt and Dr. Robert Lamoni from Aurora BayCare were the first doctors in our area to perform anterior hip replacements and have performed more than any other hospital in the area. To learn more, you can call Aurora BayCare or email healthwatch@aurorabaycare.com. And that's your Health Watch. I'm Shelley Botat, Local 5 News.